Well, as you can see in the title, this video is about my hemorrhoid or my hemorrhoidectomy, which is a hemorrhoid surgery. The reason why I'm gonna talk about this is because I'm gonna get surgery today, and I was looking to get informed about surgeries last night, and it was very hard to find videos about it. So today I want to record a video on my experience on what it is to having a hemorrhoidectomy. And I know a lot of people out there have it, but they're scared, they're ashamed to tell other people they have it. In my experience, I've been having it since I had my baby, on and off, but I have never had such a big hemorrhoid. This one that I have today is thrombus hemorrhoid, which is mean that it's just the hemorrhoid is full of blood and it's very painful. I've been having it for about 3 to 4 days, but it became so hard to walk, sit down, and I work. I had to put my patients back. I'm a medical assistant or whatever, so I had to put my patients back having a hemorrhoid. And then people out there is asking me, are you okay? Because I'm over here like limping, I couldn't walk or sit down or nothing, and people over here asking me, are you okay? I'm like, yes, something just wrong with my foot. But no, I have a hemorrhoid, but I'm scared to tell other people. So I finally asked one of the doctors that I work for, and he said, yes, you definitely need surgery. You need to get the hemorrhoid removed. Of course, I already knew this, but I was trying to procrastinate because I didn't want to get a hemorrhoid removed. Anyway, I couldn't sleep for like 3 nights. Literally, a hemorrhoid is a pain on the butt, literally. So my hemorrhoid is like this big. That's pretty big for a hemorrhoid. When I went to the surgeon, he said it will be best to have it done at the hospital because it's very painful, and he didn't want to lie to me like, hey, yes, you can get it done here. No. They told me I cannot eat anything. My procedure starts at 11:30. Right now is 9 o'clock. I have to be there at the hospital at 9:30. I'm just leaving. I'm pretty sure I'm gonna make it on time. They told me not to eat or drink anything. I had some water because I was thirsty. And how I said, I didn't sleep all last night. I know a lot of you out there have hemorrhoids, have children, we have kids, and it happens. It happens. It's normal. It happens. People are ashamed to talk about it, but I realized I want to make a video so people know how it is. I'm only 22 years old, but I have a baby. And since I have my baby, I started having hemorrhoids. I was fine. Like, I woke up fine yesterday. I was at work, and out of nowhere, I needed to use the restroom. I needed to take a shit. And I was crying. It was bad. It was bad. It was swollen. I put numbing cream. That didn't work. I did everything. So I knew at that moment I needed to get it removed. If y'all have any questions, y'all want to know anything about it, just ask down below. Put me a comment. I will do it. This is the first video I ever done, but I think it was going to be very informative. So if you have any questions, please ask me. I will let you know. Okay, so I just made it to the hospital, Northside Hospital, and I'm nervous as hell. I promise. I'm so nervous right now. Like, I feel like I have a fever, like my blood pressure is going high. I don't know. It just happened because I just got to the hospital. But I'm here. I'm 5 minutes late, like always. But I will let you know when I get up there what is going on. I'll keep you updated. I'm in pain right now. It hurt like a motherfucker. Oh, sorry. Well, be back later. Okay, so I'm back. I'm in here already, as you can see. They're gonna put my dad came with me. They're gonna put my dad back later. They almost didn't do my surgery because I was eating gum. So the lady from was like, when you go back there, let them know you're eating gum because they're probably gonna have to reschedule your procedure. But okay, I will. I'll throw away the gum. I'm not letting nobody know. Fuck that. I need this removed. Anyways, It's funny how they did a urine test on me, but they told me I couldn't drink or eat anything, so I didn't have pee. I'm like, I had to sit around, then they couldn't give me water. But finally, I got some urine for them. And now I'm just waiting. They say they're gonna put my IV, and then they're gonna put my dad back, and then they're gonna let him out and let him back in. So I am feeling nervous. I have to. I mean, hello. Very painful, but that's it. I'm just on one side. So I'm happy that I'm gonna get it done, and I'm so hungry. And I'm craving Chipotle right now. Chipotle is my favorite food, so I'm craving Chipotle. Okay, keep you updated. This is our outpatient procedure, right? So if everything goes fine, I get to go home today. Has Dr. Walt come and talk to you yet? No, he hasn't, but I saw him yesterday.
Okay. That's a good question for him, but I would assume so. It's a very quick procedure, so I would think so.
¿Tiene sangre?
Aquí tengo una, pero aquí mira, esa venita, la que están ahí, esa chiquita no tiene sangre usualmente. Y estas que tengo aquí tienen, pero duelen mucho. Y de todas estas que tengo aquí me sacaron esa de ahí. Aquí.
Now, is the only medicine that you take the micro?
It's nice to meet you. Have you ever had problems with anesthesia before? Are you having any chest pain or shortness of breath? No. Can I see your mouth? Can I see your teeth? And can you move your neck without any pain? Okay, so we're going to use that IV to go off to sleep. Once you're off to sleep, we'll place a breathing tube. We are going to have to turn you over after we go off to sleep, and then turn you back over when we're ready to wake you up. So with that movement, you may notice a little more of a scratchy throat. Your throat's not used to having anything touching it. You know, your vocal cords, nothing touches them. If you even get a drop of water on them, you're So whenever we move you around with that breathing tube there, you have more of a scratchy throat. So ice, water, chloroseptic spray, totally fine for that, okay? The medicine can affect your heart rate, your blood pressure, and your breathing. And that's what we're trained to do, is to treat any changes that are significant as soon as we see them. Anesthesia can always be life-threatening. You're going to do great. You have really no risk factors at all. And the procedure itself is very low risk, okay?
I got my gallbladder removed before, and it was pretty fine.
Pretty fine, yeah. Did you vomit?
No.
No, okay. I'm going to put a nausea patch on you too, just make sure you don't vomit, okay? That breathing tube is going in your mouth, so always a risk of damage to your teeth, lip, or gums. That's very unlikely, okay? Okay, we'll be ready shortly then.
Thank you. ¿Eso es la anestesióloga? No high yet, but I will be high in a few minutes. So I'll see you when I'm high. Bye.
Ahí la tenemos, se está yendo. Pero
I'm high.
Se está yendo de la...
I'm high.
You're relaxed.
Very.
Give her a hug already.
Okay, so I'm out. Don't mind my hair and my look. They had to flip me over. The last thing I remember was oxygen put in my face, and then I fell asleep. I don't remember anything else. My surgery started around 11, and it's... What time is it? ¿Qué hora es?
Las 2:06.
It's 2 o'clock, so 2:06. So it's been about 3 hours. I don't know. I feel okay. My mouth is so dry. I'm so thirsty. Finally, I bite my tongue or something. I have peed 3 times. They say that's a lot of times. My rectal area on the right side is in a lot of pain right now. I cannot lie, it's in a lot of pain. But I already went to the restroom by myself. I'm doing pretty good. They want me to eat. I'm not hungry. Like, they brought me like Gatorade and Graham cookies. I am not hungry. I'm just thirsty. I feel so tired, and I really want Chipotle, and that's all I want. The doctor hasn't speak with me. I literally just got to the room. I'm no high. I don't feel dizzy or anything. I'm okay. I'm just in pain, and a lot of pain. I would say it's like a 7 or 8 right now. I wanna cry, but it's because of pain. I'm not gonna cry. They're gonna give me some pain medications. They give me like a little, it looked like a tampon, but you put it in your rectum. It has antibiotics, so when I went to the restroom, it fell. It's a lot of blood here in the bed I am. So they're gonna give me another one. My throat hurts. It's dry. And how I say, if you see like I wanna cry, it's just because my rectum really hurts, but other than that, I feel pretty good. I mean, that's it. Just drinking water and water. And I haven't spoken with the doctor, so let's see what they say, and then I get back. Bye. Okay, so I'm home. The medicine have worn off. I don't know. I thought it was fine earlier. I'm like, oh, this is it. That's it. I just have a little bit of pain on my butt, but no, the medicine have worn off. I started bleeding. I went to pee, and I started bleeding a lot. I feel a lot of pressure when I walk. I feel very, very nauseous and tired. They give me some Percocet, but the medicine is not ready yet. My dad is gonna go get it. I'm sitting on 2 pillows, kind of like on my sides a little bit. I look like a mess, but it's okay. I really need the medicine. I thought this was gonna be fast, but he said it will take me 2 weeks to up to a month for recovery, depending on how well I do. He said I could go back to work on Monday if I'm not walking too much, sitting or lifting. I can go back to work. And if I don't have any pain, if I have pain, I'm gonna have to keep taking the medicine. So it do hurt, but this is it. It's done. I will take my pill in a little bit, and I'll give you an update like Sunday. Today's Friday, so I give you an update on Sunday or Monday on what is going on. Right now, I'm nauseous. I was checking my throat because it was itching, and I have bruises all over my mouth, like red-ish. I have cuts. My chest hurt. My tongue is numb. That's why I'm talking like that. I don't want to talk. I just want to lay down. I feel very bad right now, but I don't want to like worry everybody around me. I just want to take the pill, go to sleep, rest it off. I started eating because I was starving, but then I couldn't eat. I'm taking a stool softener right now. It's metamucil, and they sent me a muscle relaxer to the pharmacy plus the Percocet. I will be taking that later. This was my experience in having that's my daughter. That was my experience of having the hemorrhoid removed. I did pretty good at the hospital. I went to the bathroom. I didn't do number 2, only 1, but I did it like 5 times. And they told me if I want to go home, I could because I was fine. Or if I wanted to do more recovery there, of course I want to come home. I'm going to watch the cooking channel and be better. Can't wait for my baby to be home, my boyfriend. He will take care of me very well, I know that. And I feel very comfortable. Like if they give me some rectal cream and numbing cream for the rectum, so the only one I feel comfortable that is putting it on is him. So that's it. If you have any questions, ask down below. I'm not dying, but it's very painful. I hope I'll be better tomorrow. Thank you guys for watching. If you like it, give me some thumbs up. Give a like for me, please, if you like it. If you want another video, let me know. If you didn't like it at all, just don't watch it. You know, what is this about? Ask any questions you might have, and I'll be answering it soon. Thank you.